So I'm going to give this another try. I recorded this video yesterday talking about diabetes. I had mentioned in the beginning, or in an announcement that I had, I don't know where it went. I think when I went to save it, instead of saying convert, I have no idea, but it disappeared and that was quite unfortunate. Because I was pretty happy with how it came out. It was very concise, to the point, and exactly what you needed to know as far as the level of this class and the units and all of that. So I apologize for it taking me this long to get it out, about a week later than I had anticipated. However, I did push our midterm out, and I do think that you'll find the way that it's explained and kind of what I'm wanting you to get from it will be A, beneficial, B, you've done other assignments that help bring everything together, and it will just kind of flow. That's what my hope is for it. So hopefully it goes from what I thought went well yesterday, will be the same today. Really, the PowerPoint I'm just kind of using as a background. So I will, of course, hit upon some of these uh, things that we're talking about as far as minimizing your risk for diabetes and whatnot. But prior to even starting the PowerPoint, what I do want you to know, so I'm going to tell you what's important throughout the PowerPoint, meaning quiz, tests, midterms, final, things like that. So I will tell you right now that it is important for you to understand that the organ that is most and luckily, excuse me, luckily the video that I had posted from osmosis.com talks a lot about this, and I feel like that with this included goes really well together. So I hope you feel the same way. So the organ that is most closely related to diabetes is going to be your pancreas, of course. With most things that go on in the body, it's not just one organ or one thing or whatnot, but if there was a question, perhaps which organ is most closely related to diabetes, that would be your pancreas. So you do need to know that, please. Also, there are 4 different types of diabetes. 3 I need you to please be aware of. The other one I'm going to mention just for good, you know, manner, and it does mention it in the PowerPoint, so I think that's important. So I'm going to mention a couple things before we go through the PowerPoint. The PowerPoint's very short, and this video will probably be about 20. I think yesterday it ended up being about 25 minutes. It's just the highlights, because again, and I thank you for doing your worksheet in the book about for your own health, just because I mean that's one reason this class is or people may be taking the class because it's a prerequisite for something, or they are just interested about health and all of that. So learning if you are at risk for diabetes. So thank you, I appreciate you sharing that with me. I thought that was a really cool kind of little activity to be able to do. So the 3, well, I'll tell you the 4 types, but the 4 types of total of types of diabetes would be type 1 diabetes, type 2 diabetes, gestational diabetes, and diabetes insipidus. So diabetes insipidus is the one that you don't need to know. We'll go very, very, very graze over it when we get to it in the PowerPoint, but it does exist. So if you hear the word, it is an actual thing. So type 1, as you probably watched in the video and read about, type 1 diabetes is usually, well, not usually, it's basically means that you are resistant to, insulin. So sorry. I just got done teaching a 4-hour class online, so my speech is kind of, I'm trying, if you can tell, to be a little bit more calm, because I taught all day this morning and then a 3-hour online class, and now I'm redoing this because I feel so bad it's taking me so long. So we went over the pancreas and the importance of that. Then I also, before I introduce type 1, type 2, and then gestational, I want you to be aware of the importance of insulin. So insulin basically is very important because that is what allows glucose in our body, and that's sugar, right? And energy, and how one of the ways that our body runs off of, being able to have energy, get things done, is if it's in our cells. And if we just have all of the sugar running through the blood and our cells are not able to take it in, and insulin is what does that, we're going to have just all the sugar in the blood and we're not going to feel good. We're going to feel tired. We're going to feel the effects of that because it's not actually in the place that it needs to be. So another question and something important is, what does insulin do? Insulin is basically, it's like a key to allow glucose to go into the cell in order for your body to utilize energy properly. So that is something else that is important. So type 1 diabetes is insulin resistant, which means that unfortunately, and I'm going to give kind of the very black and white basics. There can be, of course, what's it called? Things can happen. I mean, people can actually end up with type 1 diabetes at age 12 all of a sudden. So I'm giving kind of the overview because that's what I think is most important. So of course, there's always exceptions to the rules, what I wanted to say. So type 1 diabetes is where you basically, you are required to take insulin. Your body it does not create insulin, basically. So you need to inject yourself with insulin. So that is when you will test your blood sugar. You don't need to be responsible for the numbers, but you test your blood sugar. There's different ways. I would say the most known way would be where you prick your finger and then you would put it on a little strip and then put it in a little machine, and then it tells you what your blood sugar is. And then you kind of go off a sliding scale of how much insulin your body needs in order to intake as much glucose as your body is telling you at that time. So that is, again, you're not going to need to know the numbers. Oh, you know what? I'm so sorry. I just realized I said something backwards. So going back just one step, type 1 diabetes is not insulin resistance. That's type 2. My apologies. So type 1, that is, everything else is up to par and where we need to be and what you need to know. But my apologies, type 1, that's why you're usually born with it. It has more to do with your body. It's kind of like being born with, Crohn's disease or a certain type of disease. But it's where your own body is basically, I guess it's autoimmune. You don't have to know exactly what that means, but where your body is attacking itself. So it's not able to produce what it needs to produce in order to take in your glucose into your cells. And what takes in your glucose? Insulin does. So that's type 1 diabetes. Type 2 diabetes is insulin resistant. And that usually happens due to, and that usually happens later in life. And unfortunately, we're seeing it a lot younger in our population due to obesity and our body basically just kind of, and I'll get a little bit more to it as we get into the PowerPoint, but your body just saying, nope, I'm not doing this. I'm going to resist this because you're not treating me right, kind of thing. So it's insulin resistance. So it's good to know those terms. So type 1 is autoimmune. Type 2 is insulin resistant. So those two terms would be important to know as well. And it basically means that usually, and the hope and what we try to do is then do lifestyle changes at that point. If type 1, unfortunately, that's not curable this day and age. We haven't, there's no cure for it as far as I'm aware, or maybe there is, and it's not been heard of or whatnot, but I've never heard of it here in the United States. But you will be on insulin for the rest of your life. So you're insulin dependent. That's what I meant on insulin resistant. So you're insulin dependent, but you will need the insulin in order to let the glucose go into your cell. So it's not going into your bloodstream. And if you can imagine, that would make your bloodstream, I kind of always think of it as like very syrupy, and having all of that syrup going throughout your vascular system, which can't be good, right? Because what does blood carry? blood carries oxygen. And if it's syrupy, it's not going to carry as much oxygen to places in our body, which you'll see later on in the PowerPoint, what that can cause. And then the third one that you need to please be aware of is called gestational diabetes. And all you need to know about that is that, oh, sorry, I didn't finish on type 2. So type 2, sometimes insulin does need to be used, but we try to, do lifestyle changes, which we'll briefly go over by, maybe losing weight or lifestyle changes such as diet, exercise. There's certain oral medications you don't need to know the names of, but it's more lifestyle based. Sometimes insulin does need to be used. It just depends. And it can go away basically if certain aspects and things are done and lifestyle changes. And it's not easy. I mean, that's a very difficult thing and the unfortunate part too with that is there's a genetic component where maybe that person's more prone to having diabetes, plus more prone to being overweight because of their genetic predisposition. I mean, just a bunch of different things that can happen. But there are some oral medications that help with helping to lower blood sugar as well. One is called metformin. You do not need to know that for the test, but I'm just letting you know so that we try to keep you off of insulin and try to get you on a plan to prevent, or if you're pre-diabetic, that seems to be something that's very well known. We really want to prevent you from becoming diabetic. Remember, type 1, that's not, it just is what it is. That's not going to go away. Type 2, preventative. And then gestational diabetes happens when you are pregnant. So that's all you need to know about that. And usually when the person actually has the baby, and we're not going to get into OB and all of that, usually the diabetes will be gone, it'll be fine, but you are more prone to having gestational diabetes the next baby that you have. So there's just kind of a little intro to what you need to know. And I'm going to skip through most of these pretty quickly because I went through most of the important stuff. Not that I don't think that what the CDC has to say is important. And I mean, all of these I personally believe are very user-friendly, and you are all very capable of reading. I just want you to be able to know what's important to know because there is so much information. So another thing that I would like you to please note is hyper and hypoglycemia. So I need you to be able to understand the difference between the two. Hyper meaning above, hypo meaning below. So if someone has hyperglycemia, that means they have high glucose levels. Glucose again is sugar. And hypoglycemia means somebody has low blood sugar. And that means that and that can even happen if you don't have diabetes. We've all, I'm sure, have had both and feel it. It does not feel good. If you don't eat, let's say one day, all day till 5 o'clock, I mean, you get shaky. It's not a good feeling. So please know the terminology for those hyper and hypo. And just go through this. This is the finger stick I was talking about. You don't need to know any of the statistics. We talked about the pancreas and how that is the most notable organ having to do with diabetes, as well as we talked about insulin, which stimulates the cells to take up the glucose, as we mentioned, from the bloodstream, and it uses it as energy. And that is important to know. We talked about this. The video talks about this type 2 diabetes. I didn't say metabolic, but I'm not going to ask you if it's metabolic, but I would use insulin resistance if I asked a question about that, meaning that your body is having trouble using its insulin correctly, meaning it's having trouble taking in the insulin to be able to use the glucose. But it's getting some, unlike type 1, which is getting none unless you give yourself the injection of insulin. And we give insulin, if in case you didn't know, and I wouldn't test you on this either, but if you didn't know, it's given mainly through the subcutaneous tissue, which means the fat. So it's usually given, it can be given in other ways, IV, but it cannot be given in the muscle. If it's given in the muscle or orally, it doesn't do anything. The body doesn't know what to do with it. So usually it's given in the back of the arm or the stomach, just food for thought. As we go through this, all of this, I mean, we pretty much kind of covered as far as with type 2 diabetes being, overweight, certain genetic predisposition. I'm not going to ask any of this. I've already mainly mentioned what I was going in the beginning of what I felt was important. It mentions here prediabetes, which we talked about. And I think as long as you understand that, of course, if someone is seen to have be pre-diabetic and is told, okay, it looks like you're headed towards this way based off of your labs and your levels, then, we're going to do whatever we can to try to make it to where you don't get diabetes type 2. We talked about gestational diabetes. All you need to know is that what that means. Gestational diabetes means you have diabetes when you're pregnant. That's all I want you to know. These are some certain symptoms, of course, fatigue, because if we don't have that glucose in the cells, we don't have that energy. Nerve damage, blurred vision, wound healing, things like that have to do with what I mentioned earlier about the syrupy blood and oxygen. So if you can imagine, you're not getting the oxygen to certain areas. If you get a wound, especially on the foot, that's a big, big thing. There's actually a picture here. That's a huge issue with people with diabetes, and why we do so much teaching about it, because wounds are going to heal much slower because they're not getting that oxygen to the area where it needs to be healed. And so unfortunately, a lot of people don't come in to get treatment quick enough, and they have amputations. So that is something that is important to know, that it's very important when you have uncontrolled diabetes, especially, which is diabetes in general, that it is extremely important that if you get any type of wound, especially on the foot, you go and you see your care provider as a preventative. It's very, very, very sad, especially because a lot of the time it can be prevented, and then having to have that feeling as the person and knowing that, I've been a part of those conversations, and it's really, really hard. There's different blood tests. That's all you need to know that can tell how you're doing as far as your blood sugar. Again, you don't need to know the levels and the numbers, but they're here for you if you're interested. And then I talked about food and other things earlier, but of course we all know how to read. So I'm not going to read this to you, but I again told you what is important as far as what you would need to know on our next either quiz and or the midterm, as well as the final. So that is it. Hopefully I do not mess this up, and I'm going to stop sharing the video. Let me know if you have any questions or concerns, and I will see you guys on Tuesday. I hope you have a good weekend. Thank you so much.